Basic understanding.
Well, really,
misunderstanding of what caused migraines originally.
Yes, these drugs do work on certain people, but they're not working on the blood vessels in the brain, they're working on the ones on the outside. So anybody who derives benefit from those drugs is deriving the benefit because the vessels on the outside are being constricted.
Okay, no harm in that.
No harm in that. Well, there is harm because these drugs all cause medication overuse headache. They make it worse in the long run.
The rebound headache.
Yeah, they might give you a relief momentarily, or they might knock out that whole migraine attack. But if you have to use them on a regular basis, they will make your headaches and migraines worse.
As we know, medication, there's always side effects with medication. We've spoken about the arterial type of migraine. You spoke about another type. Do you want to go into that?
Yes, well, there are two structures that cause the pain in migraine. The one is the arteries that we've discussed, and the other are the muscles of the jaws and neck. And these muscles have got tender spots in them, which are called trigger points, and these trigger points are sending messages into the brain all the time, saying there's something wrong, I'm sore. And when enough messages come in, the brain reacts and you get a migraine. So the whole thing is to cut down the number of messages going into the brain. It's like a glass of water. If it's nearly full and you pour a little bit more in, it overflows. So you need to empty the glass. And the way that we empty the brain of incoming impulses is to neutralize these trigger points by means of this bloodless surgery, the electrocautery through the skin. And once we've neutralized these trigger points, they no longer send messages in. So that's the other half of the migraine equation. So we can now treat the blood vessels and the muscles surgically.
Absolutely fascinating. So let's find out how it benefits the patient, shall we? In a study that was reported a couple of years ago in 2007, spoke about how a group of patients, 55 patients, showed a certain improvement in quality of life.
Yes, there's a test called a quality of life test. It's a scientifically accepted measure of how bad your quality of life is from any particular illness. And the people in this study were all people who had what's called chronic daily headache. They have headache and migraine for more than half the month. It's a really debilitating condition when it gets to that frequency. And these people had, on average, their quality of life was about 30% of what it should be. 100% means you've got a wonderful quality of life. They were at about 30%. And on average, after the surgery, they went up to over 90% quality of life. So the quality of life went up almost 3 times. And it's a life-changing procedure. And it's so satisfying to see somebody who has been suffering, they've lost their job, they've been boarded, their family's breaking up, and all of a sudden...
a breakthrough in research. Talking about your research, let's look at the surgery. Where is it conducted and how long would the process be?
Well, there again, it depends how many structures have to be done, but it can be up to an hour and a half. We do it in a operating procedures room. Some of them are done under locals. Some people have what's called conscious sedation, which means it's not a full anesthetic. So they go home the same day.
So it can be done at a day clinic?
Absolutely, yes, it is.
And the healing process?
Well, the healing is like after any operation. A week later we remove the sutures, the stitches, and it takes a few weeks for the wounds to heal up perfectly, and it takes a little while for the hair to grow back. We just have to shave a little bit. It's not a big deal.
And looking at cost, what does that
also
involve?
Depends on how many procedures how many arteries have to be done, how many muscles, whether it's under local, whether it's under general. It can be anything from 5,000 up to 50,000. People have to have a scan. We have to send them for a special scan. That is also something that costs. But when you see what these people are spending on medication, in the end it actually works out much less.
Have you had enough time to observe patients over time to see as to whether their migraines recur?
Oh, yes. Now, the study that you mentioned earlier that we reported on in 2007, those patients had all been followed up for years. The results are permanent. Once you eliminate the structure where the pain is coming from, then there's no more pain. It's like if you have a toothache and they take that tooth out, it can't hurt anymore. When we cauterize the vessels and when we neutralize the trigger points, they cannot hurt anymore. It's a permanent solution. And at this stage, we are getting people flying in from all over the world, coming to us for treatment because it's not available anywhere else.
That's amazing. For Africa, that is absolutely, truly amazing.
I need to tell you about the history of this operation. Although I told you how I found out about it, there are certain ethnic groups in this country who've been incising on the temple for thousands of years for headaches. And the San people have been doing it for 50,000 years. So it's not really new, but it's done the full circle.
It's done the full circle.
Yes.
Absolutely awesome. So let's say a patient walks in, Dr. Val, how do you help them distinguish between a headache and a migraine? What sort of questions about quality of life do you ask them? Could you take viewers through that now?
Well,
what are the consequences if left untreated? It's been said that for kids, they could potentially suffer permanent psychological damage. Just in closing, because we have to wrap up soon. Yeah.
Look, the problem with children,
left untreated?
They should not be left untreated.
Okay, well, I guess they can't be because they're so difficult to live with from what's been described.
Well, now people have hope.
Absolutely. Thank you so much, Dr.
It's a great pleasure.
Thank you very much. And that's it from us today here at Health Issues, another solution coming through. For any suggestions, we're at health_issues at sabc.co.za. And join us again next time. From myself and the rest of the health team, goodbye.